Welcome to my Facebook page. If you're watching me on the live, thank you. And if you're watching the replay, thank you. I'm Dr. Hamilton Stubbs. I'm a double board certified sleep specialist, certified nutrition specialist. I'm trained as a master gardener, and I'm trained in herbal medicine and plant science. I was having a problem with rheumatoid arthritis and osteoarthritis. It was so painful that I couldn't go to sleep at night. I went to see my primary care doctor who prescribed nonsteroidal anti-inflammatory drugs. I wanted to take this medicine because it hurt so badly. But when I took the medicine, I'd have these big bruises all over my body, and that's what I could see. I was concerned about, could I be having bruises in areas that could be very dangerous? Like, could this expose me for increased risk of hemorrhagic stroke? I was concerned about that. But when you're in a lot of pain, you're kind of weighing, what do I do? Because I couldn't sleep and I couldn't walk because of the pain. The other thing that happened when I took the medication every day to control my pain, my blood pressure started to go up. And at the beginning of the pandemic, I tried to lower my blood pressure by losing some weight and controlling my salt intake. This did help, but what helped the most was when I took added sugar down to the recommended amount of the American Heart Association. And today I hardly eat any added sugar because I make mostly all of my food at home. And I don't use packaged goods or packaged spices with a lot of added sugar. So my blood pressure was doing very well, and I went to a functional medicine doctor who looked at my graph, because I take my blood pressure twice a day, and you should take yours twice a day too, once in the morning to see how high it is. And that could be an effect from sleeping at night. Your blood pressure sometimes doesn't drop, and you might end up with high blood pressure in the morning instead of a lower blood pressure. But you also need to take it in the afternoon because that's when your blood pressure is likely to be the highest if you happen to have problems with high blood pressure. So I take my blood pressure in the morning when I first wake up, and I take it again around 2 to 3 or 4 in the afternoon. And I actually take it a third time because sometimes I take it right before I go to bed just to see how I'm doing. But I noticed that my blood pressure was going up, and it didn't matter what I did, the exercise, adding the minerals, my blood pressure just would not go down. So I checked my medication, and the nonsteroidal anti-inflammatory drugs are associated with increasing your blood pressure, and they have lots of other side effects. Long-term use of nonsteroidal anti-inflammatory drugs can damage your kidneys. I knew that from sleep medicine because I'm a restless leg syndrome specialist. Restless leg syndrome is a neurologic condition that keeps people awake at night with these creepy crawly feelings in their legs and involuntary jerks. And what I noticed among some of those patients is they had started taking nonsteroidal drugs, and then they developed restless legs. Restless leg syndrome is known to be associated with certain medical conditions, one of which is kidney disease. And nonsteroidal anti-inflammatory drugs can cause kidney disease or kidney malfunction. They can damage your kidneys. So those are the reasons why I just didn't want to take this medicine long term, but I was in a lot of pain. And actually I couldn't take it. It was raising my blood pressure and causing me to bruise. So I started looking at what can I do with food. I remember about maybe 10 years ago, I had a flare-up of arthritis. This is before I was diagnosed. I hurt from the base of my head all the way to my toes when I woke up in the morning. And I talked to my husband, who had none of this problem, even though he's a little older than I am. My husband was diagnosed with prostate cancer, and in 2006, I started him on a raw foods diet. So I decided I want to try that raw foods diet myself. And in 3 days, my symptoms had decreased. And in 5 days, they were completely gone. But that was so long ago. That was about, that was at least 13 years ago. So I had really forgotten about that. But when I had this next flare up, I remembered that I had done that. So I said, let me try just juicing and see if I drink just fresh cold pressed juice, if this would control my pain. So I set out to do this for just 7 days, and I said that maybe I would do it for a whole month. I might continue drinking the juices for it ever, but I want to eat food now. So I'm not going to just have juices and a little something to eat. I want to go back to food, but I'll tell you more about how I'm going to reintroduce food into my diet. So on the first day, I didn't really feel anything, but about the third day of just drinking these juices, actually it was on the second day, was a little bit of a decrease in the pain, and each day it got better to the point that I could just walk, and that is such a joy. We take it for granted. Walking is something that you just expect that you're going to wake up in the morning and do it. So when I woke up and I couldn't walk, I just don't want to go back there. So drinking the juice, I promised I would come on and tell you what happened. It helped me tremendously. I was able to walk. Yesterday I went to Twin Lakes Park, and I walked around. It's a little painful, but I'm walking, and I'm not taking the non-steroidals. My blood pressure is in good control, so I'm going to continue doing that. And I wanted to show you another anti-inflammatory juice, and I drink it with a straw. I don't know if I can show it. I don't have enough in here to show you, but you want to drink it with a straw if you decide you want to try this. And I always recommend that you talk with your healthcare provider before you start changing your diet or adding any type of spices as supplements and spices, because even though they're over the counter, even though they're considered food, some spices and supplements are blood thinners. And if you're already taking a blood thinner, like your non-steroidal, or something a little bit stronger, you have a history of strokes or heart disease, and the doctor has put you on a type of blood thinner, adding large amounts of spices can make your blood too thin and put you at risk for bruises and unnecessary and unwanted bleeding. But this beverage that I'm drinking helps me a lot, and I'm not on any medications right now. But I do keep a antihypertensive in case I need it, but so far I haven't needed it because I've been able to control my blood pressure through diet. So this is my morning beverage, and I put in it turmeric with black powder, and I used a half of a real turmeric root, but sometimes I have the turmeric powder. I used 1 inch of fresh ginger root. I put in about a tablespoon of tart cherry juice. I used about, I'd say a half a tablespoon of collagen, and I put in 1 scoop or 325 milligrams of magnesium powder. I buy it as a form of magnesium called Calm. And I use well water. This is because my well water has minerals, and we have to have minerals to be healthy. If you're drinking distilled water or reverse osmosis water, you may consider adding some minerals because you would have taken all the minerals out. Now, I don't know how you would add enough minerals, and each minerals replacement probably has its own description of how much you add, like 1 or 2 drops. But the minerals are very important for us to have, and they help you with metabolic processes, enzyme functions, and they help you fall asleep. They're also important to rebuilding the bone. Now, the collagen that I'm using is type 2 collagen, which comes from chicken. This is the one that's been shown to help with about how I use food as medicine and how I'm reversing my early signs of chronic illness. Join my email list. I'll put the link below in the comments, and I'll invite you to some of the health challenges. Maybe I'll create a newsletter and show you some of the things that I do, and you can talk with your healthcare provider to see if they are appropriate for you. So that's all I have for you today. My 7 days are over. I'm going to be reintroducing food, but I know I need to be cautious because some foods do trigger my joint pain. So I'll be back to tell you more about that. I hope you have a blessed day. I hope this has been a blessing to you. If you want juice recipes, check me out. Click that link